Welcome to Pregnancy and Birth Diaries. Today, let's talk about IVF and ICSI and differences between these two infertility treatments. IVF stands for in vitro fertilization. So the word vitro means glass in Latin. So in vitro refers to a procedure that we perform in a lab setting using test tubes or petri dishes. So in vitro fertilization means fertilization that happens outside of our body. When we get an IVF treatment, the process involves stimulating our ovaries with hormones in order to get them to produce as many eggs as possible because normally one egg is released during natural menstrual cycle, and IVF needs more eggs to ensure that there are healthy fertilized eggs to insert back later. During ovarian stimulation, usually doctors do ultrasound scans and blood tests to see when is the optimal time for egg retrieval. So then the mature eggs are retrieved from our ovaries to be fertilized with sperm in a lab. For egg retrieval, they use minimally invasive surgical procedure called in transvaginal ultrasound guided follicle aspiration, where a thin needle is inserted through the vaginal wall and into each ovarian follicle, and then they collect an egg. They collect it with its fluid. It's in a fluid. Then it's taken to the lab where the eggs are isolated and identified under a microscope, and healthy eggs are then fertilized with sperm. This is where the difference between IVF and ICSI comes in. The fertilization is done either through conventional IVF, which is mixing eggs and sperm together in a dish and wait for them to find each other, or in cases when there are sperm abnormalities or when the sperm cannot penetrate the egg without assistance, then ICSI, intracidal plasmic sperm injection, is used, in which case a single sperm is injected directly into each egg. After successful fertilization, the egg and the sperm turn into an embryo and is cultured in the laboratory for a few days and then transferred into the woman's uterus. If it successfully implants, it continues into a pregnancy. Unfortunately, IVF or ICSI treatment does not always end with a pregnancy, so numerous attempts might be necessary before establishing a healthy pregnancy. One full cycle of IVF might take about 2 to 3 weeks, so you might want to consider the time aspect of it and the emotional and mental toll these cycle of treatments might take, as well as costs, of course, which we will talk about a bit later. By the way, any extra viable embryos that resulted in this fertilization process may be cryopreserved, frozen for future use. So, IVF is usually recommended for couples with infertility due to different reasons like blocked fallopian tubes, ovulation disorders, or unexplained infertility. ICSI, a micromanipulation technique, is used when there are severe male factor infertility issues such as low sperm count, poor sperm motility, or abnormal sperm morphology, because in this case, even a small number of sperm can be used to fertilize an egg, which makes it a highly effective treatment for severe male infertility. So usually, the rest of the IVF process, including ovarian stimulation, egg retrieval, embryo culture, and embryo transfer, is the same as in standard IVF treatment. The success rates of IVF and ICSI depend on different factors such as the age of the woman, the cause of infertility, and the quality of embryos. Generally, younger women tend to have higher success rates with IVF and ICSI compared to more mature women. Also, success rates may be influenced by the quality of the fertility clinic, the experience of the medical team. So, you might want to consider that as well. Let's not forget that IVF and ICSI are complex procedures. that involve risks and considerations. And ovarian stimulation medications may cause side effects such as bloating, mood swings, and ovarian hyperstimulation syndrome. After this video, you can watch my interview here about the side effects of this procedure. Obviously, the procedures might carry a risk of multiple pregnancies, twins, and triplets, which can increase the risk of complications for both the mother and babies. There is also a risk of complications related to egg retrieval and embryo transfer. But of course, you are going to talk to a doctor and clarify all these points during the consultations. As I have mentioned, you should be prepared for the emotional and financial stresses that come with such fertility treatments. The cost of IVF and ICSI obviously depend on factors like location, the specific clinic, and any additional procedures or medications required. IVF and ICSI are not covered by insurance, and out of pocket costs can be quite significant. Some clinics offer financing options or payment plans to help make fertility treatment more affordable, where, for example, you don't pay a lump sum amount but agree on monthly payments so that you can pay off over the course of, I don't know, 2 or 3 years. It's very important that you find out all the total cost of the treatment, including consultation fees, diagnostic tests, medications, other procedures, any additional services before you agree on getting the treatment, so that you are prepared financially and you don't get any surprise charges, which might cause additional stress that you don't need. All right, that is it for today. Work closely with your fertility specialist and consult with more than one medical professional. And yeah, best of luck.